Welcome everyone to Healthcare for All, brought to you by WCANradio.com. This program examines the issues of healthcare for you. Join us now in the studio where the program is in progress.
Welcome everybody. I'm Debbie Silverstein, your host of Healthcare for All, sponsored by SPAN Ohio, and I'm here in the studio with my co-host Eric Meadows and our guest, Mark Dudzic from the Labor Campaign for Single Payer.
Good evening, everyone. This is Eric Meadows. I'd like to welcome Mark. How are you, Mark?
Hi, Eric. Great to be here.
Great. It's good to have you on.
Well, we'd also like to invite our listeners to join in tonight by calling 1-800-921-2204. You can call in with questions or comments as you're listening to the program, or you can email questions and comments to WCANradio@yahoo.com. And we do have an email from last time.
Okay.
That we're going to talk about. And Mark, you can probably help answer this as well. Arlene from Athens, Ohio wrote, will the Affordable Care Act fail at some point because it does not have sufficient cost control provision? And do you think that some states will use waivers to demonstrate the cost effectiveness of single payer before the point of the Affordable Care Act failing?
Well, the short answer is yes, the Affordable Care Act will fail because it's based on a for-profit model that's just doomed to provide poor quality and unaffordable health care for everybody. And the hope is that, a solution will emerge out of the other end, either on a state level or on a national level, to move it to a system where health care is a right for everybody.
Well, yeah, I would agree with you that I think that the Affordable Care Act will fail because it's not going to control costs. We've seen that in Massachusetts. They're having a difficult time controlling costs, and they're going back in and they're looking at that now. And starting in 2017, though, the states can apply for waivers to do innovations, so they can make some changes from this. Vermont will probably be the first state that will apply for those waivers, because they have passed a bill that will lead to a single-payer plan. And if Vermont and some other states can do that and show it to us, then hopefully we'll get to that point. So.
You're right, Debbie, but the devil is in the details. And
yeah.
There's going to be I think there will be a big fight over the whole waiver issue and what they're willing to waive. I don't think the for-profit insurance and medical industry is going to take it lying down.
Well, I would agree with you on that, because there was plenty of money spent by that for-profit industry during the debate over the Affordable Care Act. And, that was our premium dollars that, instead of being spent on health care, were being spent to actually lobby against us, to provide us with fewer protections and less for our money. So it's going to be a big fight no matter what happens. And part of it, I've got to make this rant. I was telling Eric this before the show. I have a rant I've got to get out of my system. Part of it is all of the misinformation that's out there. Now, I'm going to say I'm not a huge fan of the Affordable Care Act. I think that it is a step towards the right direction. I think it is a temporary respite at best. And my biggest concern is that it doesn't cover enough everyone. It should cover everyone. And there aren't really any proven cost controls in that. But the thing that gets me is the misinformation that was slung around about it and is still and continuing to be slung around about the Affordable Care Act. And this comes from talking to a friend who really didn't understand the act but told me she was totally opposed to it. And the reason why is because her father, who is 95 years old and in good health now, will be denied health care because he'll have to go before the board. And they will deny him the care he needs because of his age, even though he has the money that he could pay for it. And I said, well, what board are you talking about? Well, there's a board in the Affordable Care Act, she says, and she sent me an article that said that, seniors will be rationed on health care dependent upon their age and whether it's cost effective to treat them and that type of thing. And people send this kind of information out. It started out with Sarah Palin's death panels, and we're still putting that information out. And we are preying on people. We're preying on their fears, because fear is a very strong motivator. And can you imagine if you were her and you were talking about your father and you felt that the government could tell your father, no, you just have to lay down and die. Can you imagine that anguish?
Yeah, I know that. You know, the other side of the story is that every day insurance companies tell their customers that
Yes.
they have to lay down and die. And, you know, that's seen as part of the natural world that people live in. So it's like they're taking the worst and most horrific features of the current system and trying to pin it on the aspirations of anybody who's trying to reform that system.
Mm-hmm. Well, you know, and I did do some research on this because this has bothered me because it keeps coming up. And in actuality, what it's coming from now is that the Affordable Care Act does create the Independent Payment Advisory Board for Medicare.
Mm-hmm.
And they're saying that that's the board that's going to do it. However, the Affordable Care Act specifically, and it's very clear, says they cannot ration care to Medicare recipients. They cannot ration care. And it's in the act, and it's clearly written.
You know, if I can just say something about this, even with the fear-mongering that's going on, one of the things that everybody across the country, regardless what age, what gender you are, you're going to have to wait for this to come into play. So if you do have fears about it, well, you're not going to stop it, for one thing.
Right.
Secondly, you're going to have to, if I can say this, exploit it for what it is and take advantage of those areas that you can take advantage of. Until it begins. Now, we started out saying, is it going to fail? I think it's not so much going to fail as much as it will evolve
Right.
into something that's going to be beneficial to the whole nation.
Well, let's hope that it does evolve.
Yeah,
You know, and to be honest, I don't want to see it fail because, you know, I don't want to say fail from the standpoint because that hurts people.
Yes, yes.
That hurts people. What I would like to see is what the word you used, Derek, which is evolve, because that would actually work towards or for people.
Yeah.
And that. But I guess my thing about the misinformation is if it sounds really outrageous, check it out. Check it out. Don't believe everything that you hear. You have to go look for your own sources of information. And unfortunately, there are people out there, and it's reprehensible and it's downright cruel when people do that.
Well, you know, I have to say that misinformation is something that's always going to be a part of this particular life, and especially when you're dealing in politics and things that are going to involve a lot of money.
I know.
You're going to have people out there that are susceptible to whatever they hear or read, and you're going to have people out there that are going to be willing to say any and everything so that they can throw folks off the track. The longer you can delay the change from taking money out of the actual insurance company's pockets, the longer you can delay that, the better it is.
That's true.
So, you know, your friend, she's going to have to deal with it. No need to go to bed every night in fear, thinking that there's this board that's out there that's just going to tell your father to lay down and die. It's not going to happen.
Yeah, it's, you know, it's just...
That's not even the American way.
Well, no, but some people claim that we're not on the American way anymore. So.
Yeah, well, I don't know if you should play some of the rants against Medicare that people like Ronald Reagan were putting on the American public in 1964 before they passed that act. And, you know, there was a massive fear-mongering back then. It was the road to servitude. And, you know, now people would rise up in revolt if they tried to take away Medicare.
That's true.
So,
Exactly. Well, we were all going to, back then, we all had to go out and work in the wheat fields if we passed Medicare.
that's right.
So, well, Mark, let's learn a little bit about you. You are a national organizer and chairman of the United States Labor Party, as well as a labor activist. You were the president of a local union, of a branch of the Oil, Chemical, and Atomic Workers International Union, correct?
Mm-hmm.
And you're also a national coordinator for the Labor Campaign for Single Payer. What is the Labor Campaign for Single Payer?
Well, we launched the Labor Campaign for Single Payer in 2009, actually right after the election of President Obama. And it's a coalition of national, local, and regional labor organizations. And our vision is that labor has to lead this fight for health care justice in America. And that labor, in order to do that, labor has to do a lot more than what it's been doing in organizing. So we see our role as first working within the labor movement to move it into a more active and energized stance on health care reform, And then secondly, helping to build broader coalitions and reaching out into the communities and helping to be part of a broader social movement for healthcare justice in America.
Well, why should labor be involved in this? Why is this labor's fight?
Well, there's I guess you can look at it from two different perspectives. If you're part of labor, I would maintain that you have no choice but to find a way to get health care off the bargaining table. It's become an unsustainable issue. Historically, most workers in America have gotten their health care coverage through employment, and they've done that because unions fought and died for those rights in the 1930s and the 1940s. But the cost of health care has exploded at a rate of 2, 3, 4 times faster than our wages. Has been happening consistently over the last 20 years. Employers are dumping health care benefits. Public employers, as I'm sure you're aware, in the Midwest have been, dealing with the fiscal crises of the state and local governments by shifting health care costs onto workers, and it's basically unsustainable. It's the biggest cause of strikes and lockouts and other kinds of workplace disputes. And then the other reason from the broader social outlook is that labor needs to be involved in this fight, because that's the only way we're going to win health care for all in America, is when labor finally shifts its weight and the focus of its organizing efforts into the fight for health care justice. And when that happens, we will win. And you saw the fight that labor took up last year in Ohio when the governor tried to pull away collective bargaining rights. There's a massive statewide mobilization, and that's what it's going to take to win health care for everybody in America. And if labor mobilized the way it did in Ohio for health care, we would win it.
That's true, because that was a wonderful campaign, and and they did a wonderful job on that. The unfortunate part is, at the same time, there was an amendment on to the Constitution on the ballot called the Healthcare Freedom Amendment, which allows us the freedom to die young and in debt.
Yeah.
And restricts the state from being able to do anything in the healthcare field as far as any changes.
Wow.
I followed that from afar, and it just boggled my mind.
I know, and we dropped the ball on that one. So we're going to have to overcome that here in Ohio, and that type of thing. But really, when labor really gets their act together, when labor comes in there and is on a mission, labor can get things done. Labor's done that in the past.
Mark,
Absolutely.
I do have a question to ask, because now there has been an attack against the form of unions, regardless of where they're coming from. Now, you're saying labor is going to have to step in and lead this fight. If that's the case, then they need to make their presence even more so known, not just with those that have joined the union, but also those that are on the outside of it. How are they going to incorporate both those who presently have jobs where there are no unions and those that are affiliated with unions? How are they going to incorporate both of these parties together?
Well, that's a great point, Eric. And a lot of us who joined the labor campaign for single payer believe that this is part of a process that will transform the labor movement back into what it needs to be, which is a social movement that speaks on behalf of all working people. And that's where labor came from. That's where our roots are. And we kind of lost our way during the fat and sassy 1960s and the 1970s, and became seen as sort of an interest group, only speaking on behalf of our already organized members.
Yes.
We think that that's been a real a wrong turn for the labor movement, and involvement in this fight and similar fights for social justice puts us back on the right track, where we can really be a vibrant movement of working people, whether you're employed or unemployed, whether you're working in a union shop or in a non-union situation, whether you're retired, whether you're going to college, and try to speak to all of those broad interests. That's how we're going to survive and grow as a movement.
Well, there is evidence, Mark, that there are benefits to non-union workers by having union shops and union workers in the same state. We see a big difference between wages overall in states where unions are prevalent compared to what's known as right-to-work states. Isn't that correct?
That's it's indisputable. I mean, there's a union advantage of something like 20 to 35% in terms of both wages and other benefits. You're much more likely to have a pension if you're in a union shop or in a state with a lot of union members. If you're a woman, if you're a person of color, the advantages are even greater. So, labor has, transformed the conditions for the entire working Americans over the last 50 years. It wouldn't be the same country without the labor movement.
That's so true. Mark, I have another question to ask.
Sure.
You said taking health care off the bargaining table. That means now the Affordable Care Act, when it comes into full implementation in 2017, by that time, everybody will be in a position, should be in a position to actually, or have to buy insurance for themselves. They'll have to be covered. That will effectively take it off the bargaining table, won't it?
Not necessarily, Eric.
How not? Why not?
Because
Not at all, actually.
Yeah, people have it through their employment. The only ones that have to buy it for themselves are the ones that don't get it through their employment.
Okay, well now the ACA is supposed to actually make it so that small and large business is going to be able to flourish with this. I mean, is the cost going to be just as high? Is it going to be something that's going to affect the business itself?
Well, I think the ACA actually introduces a lot of new complications into employer-provided benefits. And it relies on the continuance and expansion of employer-provided benefits. I think, Debbie, you can help me here. I think they anticipate only 15 or 20% of Americans purchasing their benefits through exchanges or getting them through expanded Medicaid. So most people are supposed to get them through employment, and in fact the ACA penalizes large employers who don't provide a certain standard of benefits. So, it's a real mixed bag, but I think that there's a bunch of new stresses that are going to take place as the ACA is rolled out, both in terms of what we call race to the bottom pressures, where they've set these tiers of benefits, starting with bronze and moving up to platinum, bronze, silver, gold, platinum. An employer has to provide at least a bronze level of benefits, which is supposed to have an actuarial value of about 60%, which means that in general, about 60% of your expenses are supposed to be reimbursed under a bronze plan. And if you've ever seen a hospital bill after a week in the hospital, you'll know how good a plan like that is going to be.
Okay.
Yeah, pretty skimpy. Well, yeah, I think, first of all, it's an accident of history that health care benefits are associated with employment. That only came about because there were wage and price controls in effect, and businesses, I think it was Roosevelt, wanted to do a national health program, but businesses said, no, let us do that so that we can attract employees. And it started out that way. And it's always been an expectation on the part of people that health care benefits come with your job. But what we're finding is that more and more firms are not offering it, especially the small firms, because they can't. It's too expensive for them.
Exactly. In today's climate, it's going to continue to be very expensive.
Well, when you look at family coverage, for a typical plan is $16,000 a year. Now, the employee can't afford it. When you look at median household income, that's about, and we're talking household, not individual, the household income is around $50,000. So half of us live on $50,000 or less. The individual cannot afford $16,000 to purchase health insurance. The business can't afford these prices that keep going up and up and up and up as well, because, like Mark said, the cost of that insurance has risen at a higher rate than the cost of our income
That's true. That's
has
true.
done. And so I think we're down to about 51% of businesses now offer healthcare benefits.
Really?
And so, yeah.
51%?
Yeah.
I would have thought it'd been higher than that.
No, it was at one time, but we're...
Well, that's 51% of total businesses.
Yeah.
I think about 65 or 70% of people who work still get health care benefits. It's mostly the smallest businesses that don't offer them. But
Well,
it's declining every year, and it has for
Yeah.
the last 20 years.
okay.
Well, and if it's not declining as far as offering it entirely, what is happening with greater frequency is that the cost of those benefits are being shared with the employee. That we call it cost sharing or cost shifting, but it's being shifted from the employer over to the employee, which then makes it unaffordable again. And what happens is then the employee drops it. And we've had a person that has called in to this show many times. She and her husband dropped their employer-sponsored insurance because they had to pay $2,500 a month. I don't know about you, but I probably would have dropped it sooner than that because that's almost my entire monthly income.
Talk to the Walmart workers.
Yes.
They can't afford to purchase the employer-provided insurance that they get. It would suck up almost all of their wages.
Well, Mark, you said that now with the ACA being implemented, it will take up 60%. That other 40%, is it going to be the employee himself that has to cover it, or is the government going to step in and pick up a portion of that bill?
Well, it's a complex system. If you make below a certain amount, approximately 4 times federal poverty level, like 50 grand for a family of 4, there would be some subsidized coverage available on the exchanges, but not necessarily through employer-provided benefits. So one of the concerns that people are having is that there may be a perverse incentive for employers to stop covering their employees and dumping their employees onto these new state exchanges and forcing them to get subsidized coverage through the exchanges.
Well, if that's the case, the bottom line is that the employee ends up being the one to foot the major portion of the bill. I mean, even if the government steps in, they're not going to pick up, what, 25, 30% of it?
Actually, it depends on their income level.
Right.
In some cases, yeah, they are going to be picking up that much because otherwise these people just would not be able to afford the coverage. You know, when you're talking about somebody that's making $25,000, you know, even as a single employee or person, you know, their health care bills, you know, are going to be about, well, if they get a bronze plan, maybe about $5,000, $6,000, could be even more per year. You know, I as a single coverage, mine is $12,000, and it's not that great a coverage. But, you know, so a person at that level is not going to be able to pay for that, and so there is going to be the subsidy that is available to them. And then there's the ones that up to 138% of poverty would be eligible for coverage through Medicaid, expanded Medicaid, if the states participate in that.
I mean, those folks, it's an unadulterated good thing. The expansion of Medicaid is, you know, even though there's problems with Medicaid, those people will live who would have died because of that. And then, you know, then there's a middle group that might be eligible for subsidized benefits, but the question is what kind of benefits and how much will they benefit from them? And then I would maintain that once you get up into sort of middle class earnings in the $50,000 family income range, there's almost no impact on things, and actually new stresses that will be brought to bear on the system as a result of the ACA.
Oh, okay. Will anybody be denied care under the ACA?
No.
Well, in the George Romney definition of being denied care, where if you go to an emergency room and wait long enough, someone will finally see you, no. But, you know, at best, they're predicting that 30 million Americans will not have health care coverage when the ACA is fully implemented in 2018.
Can you give me that number again?
30 million.
30 million Americans. Now, is this because they volunteer not to pick up the coverage, or what? Are you saying 30 million people are going to fall through the cracks?
30 million at least will fall through the cracks. Some will be undocumented immigrants who are by law prohibited from accessing these benefits. Some will be people who can't afford the coverages that are available. Some will be people who just refuse to take the coverages that are made available to them, maybe because they don't want their grandfather to be sent to a death panel or some bizarre reason. But and so, many millions more now, since the Supreme Court ruled in its wisdom that states could decide whether they want to participate in Medicaid or not. Many millions more will be excluded now in states that choose not to expand Medicaid coverage to 138%.
Yeah. When you're down at that income level, there's no way you're going to get it on your own.
Right.
Now,
right.
here's what happens in those cases, Eric, is that they don't have, because they don't have the coverage and because they don't have the income, they don't get the care they need until it becomes a crisis. And then, yes, they do present at an emergency room quite often, and it's a much greater cost to us, the taxpayers, because we will end up paying for this. But much greater because they didn't present at an earlier stage, they present at a late stage when it is critical and expensive to take care of. And under the Emergency Medical Treatment and Active Labor Act from 1986, they must be treated if they come in there. They can't just say, nope, sorry, you're not insured, go lay on the pavement and die. That can't happen.
Okay, then I have to ask this question. What is it that's going to change between now and then? I mean, it's always been that way. And I'm talking about with those who fall up underneath that income level of being able to afford either the insurance or the care, the cost of the care. They're still going to present at the hospitals like they've always been doing. They're still going to present there at the emergency rooms like they've always been doing. I guess what I'm looking at is let's exclude, and I'm just saying taking them out of the equation, the illegal immigrants who are excluded from receiving a lot of the American benefits. But now if we're just looking at the American public, is it still 30 million, or can we reduce that down to maybe 15 million?
Well, Eric, you can't take out the undocumented immigrants because the UMTALA Act, the one that I just mentioned,
right,
gives them the right to care. It says that they must be treated regardless of financial status, citizenship status, or legal status.
Mm-hmm.
So you cannot exclude them from that emergency care when they present. And yes, they will be uninsured unless they can afford to buy insurance on their own. They're excluded from the exchanges, and they're excluded from any kind of subsidy for it. But then if they need the care, and they present in an emergency room, then they have to be provided that care. And then what happens is that if it's unreimbursed care, it gets pushed off onto those of us who pay.
Right, the taxpayers. Uh-huh.
The taxpayers or the private patients. It's estimated that every person in this country that has insurance is paying about $1,000 a year because of unreimbursed care costs.
Okay, Mark, and I'm asking you this because I'd like for you to give me some understanding. If the illegal immigrant does present into an emergency room and he cannot afford it, now he then comes up on the radar screen. Am I right or wrong?
You're right. In an emergency care situation, absolutely.
Okay. Now the Obama administration is supposedly going to make moves towards making that illegal immigrant legal, or at least he's going to have to jump through some hoops so that he can become a part of this country and enjoy some of the benefits. So that is a benefit for the country. It is going to cost something to do this.
But keep in mind also, Eric, they have to be legal and in the country for 5 years before they are eligible for this.
That's fine.
So even if they're legal, they may not be eligible for this.
That's fine, but at least we've cleared one hurdle.
Yeah.
Am I right or wrong, Mark?
Yes, to some degree, but
Okay.
what it means is a undocumented immigrant with kids who's working a low-wage job not going to be able to find a regular pediatrician to take care of his kids. Or,
Even with Medicaid?
they weren't eligible.
They're not eligible.
Well,
You know, if his kid falls in the playground and breaks his arm, the emergency room has to treat that person under
Yes.
the law.
Uh-huh.
Or if the worker has diabetes and it progresses because it's untreated to the point where they have to amputate his leg, and he shows up at the emergency room, they'll amputate his leg and provide extremely expensive emergency treatment for the person. But they won't provide the kind of coverage that would allow that person to get regular medical attention for an easily controlled and preventable condition. So
Okay.
that's the sort of the kind of contradictions that are built into the current healthcare system,
Right.
and are not fully addressed under the Affordable Care Act.
Okay.
It will be lessened under the Affordable Care Act. Things will be better for millions of Americans that are excluded now, but there still will be
But-
millions of others who are continued to be excluded from.
So we can debate this all night, Mark. So, Mark, why would the unions, why would labor support a single-payer plan? What is the advantage of a single-payer plan over the Affordable Care Act?
Well, I think, you know, it's, if you believe that healthcare is a right and not a business and not a commodity, but that it's a central human right, and you believe that you want to provide quality, affordable healthcare to everybody, I mean, I think that it's really a question of science. There's not a whole lot of debate that the most effective way to deliver health care is a single-payer system. Nobody can really dispute that. It's kind of like saying, you know, the sun doesn't revolve or the earth doesn't revolve around the sun. It's, you know, if you listen closely to all of the debates, you know, people on both sides were saying, well, it's not a single-payer system, so it won't cover everybody, or it won't control the costs in the same way, but we can do this and we can do that. So there's really no question that that's the real solution. So from a labor perspective, if we recognize that we can no longer sustain a for-profit system that's based on in the workplace, we have to move to a single-payer system. And if you look at the rest of the industrialized world, where healthcare is a right, is a birthright for everybody in those countries, and where unions don't have to bargain and strike every 2 or 3 years to sustain their health care benefits, they're all some form of a basic single-payer style of health care coverage. There's some variations out there,
No.
but they basically
All right,
belong to that.
let's explain what we mean by a single-payer type of plan for listeners that may not be sure what we're talking about, because we get talking and we act like everybody knows what we're talking about. What a single-payer plan is, it's like if you're familiar with Medicare, okay, it's a financing mechanism to provide health care for everyone. And so by single-payer, we all pay into it. You can call it a premium if you want, if you're afraid of the word tax, but we all pay into this system, and then it all gets paid, all of the bills get paid out from a single source, rather than having 1,000 different insurance companies that each have about 10,000 different policies with different rules, you know, that are all paying out depending on the rules of the specific policy that they have. You know, which leads to something like that little hospital in Athens, Ohio that I talked about last month that has 125 different ways to bill a syringe. You know, when you talk about that, we're talking about the waste there. Instead, that hospital would have one way to bill a syringe, and it would be the same way every other hospital bills a syringe.
Right.
And it would all go to the same place, and it would all get compensated for properly. Now, the compensation might be different depending on the area, depending on the cost of living in that area, and that type of thing. So it's not that a very low cost of living area would get the same payment as a high rent or a high cost of living area would, and vice versa. But it would help to equalize things because all areas would be taken care of. It will especially help to equalize things as far as the health care and the disparities between rich and poor, because everyone that goes into a doctor and sees a doctor is on the same level. And, right now that isn't necessarily the case, that all patients are treated equally, because it's always been known Medicaid pays much less, and sometimes Medicaid patients have a difficult time seeing the doctors that they need to see. Out in Grand Junction, Colorado, they did an experiment where they're still doing it. They've been doing it for years. They equalize the pay for Medicare, Medicaid, and private insurance. All of them compensate at the same thing. Tremendous positive results for the Medicaid population there. They saved a tremendous amount on what they call acute care for Medicaid patients. But they also saved a tremendous amount for their Medicare patients. Their average per capita is way below. And it's because of that equality that exists there for people. So a single payer system is, okay, call it, the government collects the money, the government pays the bills. You still go to the doctor you want to go to. The doctors do not work for the government. The hospitals aren't owned by the government. Some systems have that, but that's not what's being proposed here. It's just simplifying our financing and payment mechanisms. So,
I imagine these are the steps that we're going to have to go through with the ACA before we can actually evolve to that. I don't think that single payer is, going to put its head in the sand. It's going to be there, and they'll eventually get there. That's my feeling. I do believe that, in fact, as Mark was saying, labor is going to have to step in and become the lead behind this, whether you're involved with a labor union or not.
Well, Mark, tell us what you think the prospects are of continuing the reform towards a single-payer system now that the ACA, the Affordable Care Act, is law. Some people say, okay, we're done.
Well, that's really the challenge before us, is not to circle the wagons around this partial bill that we have right now. So, I don't think the ACA on its own will not naturally evolve into a single-payer system. It does nothing to move away from the sort of profit-based private insurance model of healthcare. It tries to regulate and control that model. So if we're going to move away, we have to. There's two ways to do it. The one is to continue to push for a broad national healthcare reform. When there's a number of bills in both Congress and the Senate that have historically done that. The likelihood of this Congress passing a single-payer bill is not very likely, but it's important that you keep that vision out there. I am inspired by the fact that in the Senate, Bernie Sanders is going to be joined by several people who have historically been supporters of a single-payer Medicare for all healthcare system, including Tammy Baldwin, who was just elected from Wisconsin, Elizabeth Warren in Massachusetts, Mazie Hirono in Hawaii. So we might begin to build a bigger single-payer caucus in the Senate. The other way to do it, and you alluded to it earlier, Debbie, in the call, is there are provisions in the Affordable Care Act starting in 2014 to have states develop innovative approaches to healthcare delivery that, as long as they provide at least the same level of coverage under the Affordable Care Act, the federal government may give states waivers to experiment in other alternatives. And so, we may win single payer kind of incrementally, state by state. Vermont is furthest along the road on that.
Right.
And they just went through some state elections there that reconfirmed that the people of Vermont want to continue to move towards a single payer system. The governor was reelected. The Republicans who ran their campaign at the state level against the single-payer reform were decisively defeated. So they're going to move forward in Vermont, and it's at different levels in other states. Minnesota, they just Democrats won both houses in the state of Minnesota. The governor there has historically said he supported single-payer, so folks are very hopeful there. California is the big prize. I think if you win single payer in California,
you've got it.
You got it, because it's such a huge percentage of the U.S. economy, and it's
Right.
such a trend-setting state.
But they're the 10th largest economy in the world.
Yeah, something like that. It's
Yeah.
bigger than
Okay.
most countries. There's 30 million people there. So I mean, that's the prize, and
Right.
it's a very complex fight in California, and that's where I think the health insurance industry and for-profit medical industry will really draw the line.
Right.
But labor just won these two big fights in California this election period around a proposition to raise taxes for the first time in 2 decades. The Californians voted to raise taxes to fund education and prevent the massive layoffs of teachers. And then there was a proposition somewhat similar to what you all fought in Ohio on labor rights
Okay.
that they defeated in California. So they're feeling their oats. And again, if we can mobilize around these issues on a state level, we may be able to change the whole debate going
Right.
forward.
Right. And I think Hawaii is also posturing itself towards a single-payer plan as well. So we've got a lot of movement in a lot of different states that are going on. Now, some people will say historically that's the way social change takes place, is it comes through the states first, and that this one is going to have to do that as well. But did Medicare do that?
No.
So it's possible to do it on a national level rather than just a state by state.
Yeah, I mean, there's been a real debate about the viability of both strategies, and we in the labor campaign for single payer, we basically say, we got to just find the path forward. We got to, wherever there's progress, we got to take it and move forward, and as Eric says, evolve into this system. So I don't think there's any one road. It's more difficult in some ways on a state level. It's harder to kind of come up with the revenues that you need to finance it on a state level, and the states tend to be interdependent on each other with other states and things like that. But on the other hand, the national thing, is going to take a long time to build that momentum back up again.
That's right.
So, got to keep fighting somewhere.
Hey, Mark, the Labor Campaign for Single Payer is having a conference this January, correct?
We sure are. We're going to have our National Strategy Conference in Chicago, Illinois, January 11th through the 13th. And we're trying to get particularly folks who are active in the labor movement to come together and really put our heads together about what next steps we can take to move this fight forward.
And you couldn't pick someplace warm, Mark? Chicago in January?
Now, this is coming from someone in Ohio, right?
Yeah, well, we're stuck here, but, you might get people from Ohio if you were having it in Miami.
Yeah.
So how would people how would union people find out about this?
You can go to our website, laborforsinglepayer.org.
Okay.
laborforsinglepayer.org, and right on the front page there's an announcement for the national conference, and also contact information on how to contact me if you have a question or a concern. I would love to talk to any union anywhere about this issue. We have some really good speakers who can really address the concerns. If you're a unionist and you're in a tough bargaining fight, one of our principles is we stand with workers who are fighting to protect their own health care as we fight for a new system. Let us know what you need, and we'll try to mobilize support for you.
Okay. Well, and I hope there's some Ohio unions that are listening tonight, because I wrote you letters and invited you to attend this conference along with me, and I sure hope to see you there so that we can map out a strategy for Ohio that can be just as successful as California or Vermont, because California came within 2 votes the last time.
Yes, they did.
Of passing this. So, I have faith that California is going to come through, but Vermont is leading the charge right now, and we're going to stand behind them. And we want to position Ohio so that we can take advantage of it when it's possible.
Mark, I want to take this time to thank you for coming on to the show, and I'd like to thank all of our listeners for their continued support. I'd like to encourage everyone to join us again December 20th for the next showing on Healthcare for All. And to everybody, I'd like to wish you a good night. Wait a minute before we leave out.
Yes,
Go
I do
ahead.
want to, two things. I want to congratulate Lori Simons and Terry Sternberg. They were our guests last March. Their movie, the healthcare movie, has been chosen as an official selection of the Chicago International Social Change Film Festival and the Marta Loop Justice Film Festival. If you're interested in seeing the healthcare movie, go to the SPAN website, and that's spanohio.org, and contact the regional coordinator for your area. We all have the copies of those, and we would be happy to do a showing for you. Next month's guest will be Dr. Betty Keller. She was a volunteer and activist in Vermont. She's going to tell us how Vermont got to the head of the class.
Okay. And until then, we want to wish everybody a good night.
Thank you.
Night, folks.